The air in the trauma bay tasted of antiseptic, copper, and fear. It was a flavor Ari Carter knew better than her own name. She moved through the controlled chaos of the Kings Harbor General Emergency Department with an economy of motion that bordered on invisibility, a ghost in blue scrubs. She checked a monitor, adjusted a drip, recorded a vitals chart. Her hands were steady, her face a mask of placid competence. No one looked at her twice. She was just Nurse Carter. Competent, quiet, young, hired 6 months ago, had proven herself to be a reliable, if unremarkable, member of the team. That was the point. Unremarkable was the goal. Unremarkable was safety. "Carter!" The voice cut through the din like a breaking bone. Dr. Marcus Cross, chief of trauma surgery, stood over Trauma Bay 2, his face a thundercloud. He was a man who wore his arrogance like a second sterile gown, a fortress of ego built on a foundation of genuine, if conventional, skill. "Get in here! I need a line in this guy's other arm, now!" Ari was already moving. She grabbed a 16-gauge IV kit from the cart, her eyes scanning the patient as she approached. Male, mid-40s, motorcycle accident, obvious femur fracture, distended abdomen, shallow breathing. His blood pressure was circling the drain. "Pressure's 80/40 and dropping," the resident, a harried young man named Miller, announced. "We're already wide open on 2 units of O-neg. "He's bleeding out internally," Cross snapped, pressing the ultrasound probe hard against the man's belly. "Spleen's ruptured. Damn it, Carter, where's that line?" "Right here, doctor," Ari said, her voice even. She tied the tourniquet on the patient's left arm, her fingers palpating the crook of his elbow. The veins were collapsed. It was like trying to find a thread in a muddy field. "Just stick him, Carter. Don't write a novel about it," Cross grumbled without looking up from the monitor. A few of the other nurses exchanged glances. Dr. Cross's particular brand of condescension was usually reserved for the residents, but he seemed to have a special reserve for Nurse Carter. Maybe it was her youth. Maybe it was her quietness, which he seemed to interpret as a lack of confidence. Ari ignored him. She found what she was looking for, a deep, thready brachial vein, barely a whisper under the skin. She slid the needle in with a smooth, practiced motion. A perfect, instantaneous flash of red in the chamber. She advanced the catheter, connected the line, and opened the clamp. The second bag of blood began to flow. The whole process took less than 15 seconds. "Line's in," she said, taping it down. Cross grunted, a sound that was his version of a compliment. "Get him typed and crossed for 10 units, and activate the massive transfusion protocol. I'm taking him up to the OR." "Doctor," Ari said, her eyes still on the patient's chest. His breathing was becoming more labored, a strange paradox as his neck veins began to bulge. Beck's triad, muffled heart sounds, distended neck veins, hypotension, the classic signs. "What is it, Carter? I'm a little busy saving a life here." "His heart sounds are muffled. And look at his jugular," she pointed. "He's not just bleeding into his abdomen. I think he has a cardiac tamponade." Cross glanced at the patient's neck, then back at his ultrasound. He moved the probe from the abdomen to the chest, angling it under the sternum. His expression tightened. The screen showed the telltale sign, a dark halo of fluid compressing the heart, squeezing the life out of it. "Damn it," he breathed. "He must have cracked his sternum on the handlebars. The pericardium is full of blood." He looked at the resident. "Miller, get a pericardiocentesis tray. Now, move." As Miller scrambled away, Cross looked at Ari. A flicker of something, begrudging respect maybe, crossed his features before being buried again under his usual impatience. "Good call, Carter. You might make a decent nurse yet." He turned his back, focused once more on the patient, and she melted back into the background. Just Nurse Carter. That was all she wanted to be. For 12 years, it was all she had allowed herself to be, in one form or another. A medic in a free clinic in Thailand, a nursing assistant in a rural Australian hospital, a phlebotomist in London, a series of lives, each smaller and more anonymous than the last, each one a step further away from the dust and the screams and the person she used to be, the person who had been declared killed in action in the Hindu Kush Mountains. The doors to the ambulance bay hissed open with a blast of city air, and the triage nurse shouted, "Incoming! Priority 1!" Another wave in the endless ocean of human misery. Ari braced herself, but this was different. The paramedics burst through, flanking a gurney moving at a dead run. On the gurney was a man in a dark suit, his face pale, a growing red stain on his crisp white shirt just below the ribs. He was conscious, his jaw tight with pain. Walking, practically marching, beside the gurney was another man. He was older, in his late 60s, with a ramrod straight posture that civilian life had not managed to soften. His hair was silver, his face a roadmap of command and authority. He wore a tailored suit, but he moved like a man more accustomed to a uniform. On his lapel was a small, discreet pin. Ari's blood went cold. She knew that pin. It was the emblem of the Office of Naval Intelligence. The man was an admiral. She didn't need to see the stars on a shoulder board to know it. It was in his bearing, in the steel of his eyes, and she knew him. Her heart hammered against her ribs, a frantic prisoner. It was a feeling she hadn't had in 12 years, the feeling of being seen. Admiral Jonathan Pike, the man who had sent her on her last mission, the man who had read her eulogy at a closed-door memorial service attended by ghosts and spies. He hadn't aged a day. He just looked harder, the lines around his eyes carved deeper by time and secrets. His focus was entirely on the man on the gurney. He was shot, the Admiral said, his voice a low, powerful baritone that commanded immediate attention. Point-blank range, single-entry wound, abdomen. His name is Lieutenant Commander Evan Hayes. Blood type is AB negative. Cross was there in an instant, taking charge. All right, let's get him into Bay 1. Hayes, can you hear me? My name is Dr. Cross. He's my aide, the Admiral clarified, his voice tight. There was an attempted carjacking. It went wrong. Ari stayed by the nurse's station, her hands gripping the edge of the counter. Her knuckles were white. She felt rooted to the spot, a statue of a nurse. Don't look up. Don't let him see you. Don't. He's focused on his man. He won't see you. The team swarmed around Lieutenant Commander Hayes. They cut away his shirt, revealing a small, neat hole, oozing dark blood onto his right upper quadrant. Vitals? Cross demanded. BP 100/60, pulse 120, a nurse called out. Stable for now, Cross muttered. Let's get a fast scan, type in Cross, and book an OR. Looks like a liver lac. He glanced over his shoulder. Carter, get in here. Get a line started. The order was a physical blow. She couldn't move. Her feet were lead. Carter, Cross barked again, his patience already gone. Did you hear me? Slowly, mechanically, she forced her legs to move. She kept her head down, her blonde hair falling forward to shield her face. She grabbed another IV kit, her movements stiff, robotic. She approached the bed, keeping her back to the Admiral. She could feel his presence behind her like a physical heat, a brand on her spine. 12 years. 12 years of running, of hiding, of being nobody. It was all about to end in a brightly lit trauma bay that smelled of floor cleaner. She reached for Hayes' arm. As she did, the lieutenant commander's eyes fluttered open. They were hazy with pain and shock, but they focused on her face, a flicker of confusion. Then, impossible recognition. Doc? He whispered, his voice a dry rasp. Doc Thorne. Ari froze. The name hit the air and seemed to hang there, shimmering and deadly. Thorne. A name she had buried under a mountain of lies. Behind her she heard a sharp intake of breath. The Admiral. He had gone utterly still. The frantic energy that had propelled him into the ER had vanished, replaced by a profound, statue-like shock. His gaze was fixed on her, boring into her. The blood drained from his face, leaving the weathered skin looking like old parchment. He saw her. Not Nurse Carter. He saw the woman from 12 years ago. The woman with dirt and blood under her nails, with the haunted eyes of a surgeon who had seen too much. The woman he had sent to her death. Dr. Eris Thorne. Call sign, Valkyrie. The silence stretched, thin and fragile. The bustling noise of the ER seemed to fade into a distant hum. It was just the three of them, and the ghost of a fourth in that small space. Cross looked from the patient to Ari, his brow furrowed in confusion. Doc Thorne? What is he talking about, Carter? Admiral Pike took a single stumbling step forward. His mouth opened, but no sound came out. His eyes, the eyes of a man who had faced down enemy fleets in treacherous political waters, were wide with a disbelief so pure it was almost childlike. It can't be, he finally managed to whisper. The words were a ghost's breath. Ari didn't look at him. She couldn't. Her entire world, the fragile, anonymous world she had so painstakingly constructed, was shattering. Then the monitor shrieked. Hayes's blood pressure plummeted, 70/40, 60/30. "He's crashing," Cross yelled. "He's throwing PVCs. What the hell's going on? It's just a liver lack." "No, it's not," Ari said. Her voice was different. The quiet, deferential tone of Nurse Carter was gone. In its place was a voice of absolute, cold authority, the voice of Dr. Thorne. She looked at the entry wound again, then at the man's rapidly paling skin and the sweat beading on his forehead. The mechanism of injury, the delayed shock. It wasn't a carjacker's pistol, it was something else. She knew this injury. She had seen it a dozen times in the sand and the dust. "That's not a bullet from a handgun," she stated, her eyes locking with Cross's. "The entry wound is too small, too clean, and the shock is disproportionate to the visible blood loss. He was hit with a flechette." "A what?" Cross asked, bewildered. "It's a small, fin-stabilized dart, often coated in a coagulopath," she explained, her hands already moving, grabbing a pair of sterile gloves. "It's designed to cause massive internal bleeding that can't be easily controlled. Standard transfusion protocols won't work. You're pouring blood in while the anticoagulant is destroying his ability to clot." Admiral Pike stared at her, the shock on his face now warring with a dawning horror. He knew exactly what she was talking about. It was a weapon used in covert ops, an assassination tool. This was no carjacking. "That's insane," Cross shot back. "This is downtown Kings Harbor, not some black site." The monitor screamed again. "V-TAC." Hayes's body began to convulse. "He's in cardiac arrest," the resident shouted. "Starting compressions." "No," Ari's voice cracked like a whip. "Do not start compressions. You'll dislodge the flechette and shred his liver completely." She turned and finally, looked directly at Admiral Jonathan Pike. The years fell away. He saw the ghost he thought he'd buried. His silence was a wall of stone. He was paralyzed, caught between two impossible realities. Ari took a breath. The past and present collided. There was no more running. "Admiral," she said, her voice devoid of any emotion but absolute urgency. "Your aide is dying. Get out of my way." The words, sharp and professional and utterly impossible, broke the spell. Pike flinched as if struck. He looked from her face, the face of his best surgeon, his lost soldier, to the dying man on the table. The commander in him took over. He took 2 steps back, clearing the path. His eyes never left her. Ari turned to the stunned medical team. "Get him off the board and get me a thoracotomy tray. Now." "A what?" Cross sputtered. "We're not cracking his chest in the middle of the ER. That's barbaric. We take him to the OR." "He doesn't have time for the elevator ride," Ari stated flatly. "His heart is failing from the toxic shock and hypovolemia. We have to open him up, clamp the aorta, and find the bleeder. Here, now." Not a request, a command. "You are a nurse," Cross roared, his face turning purple. "You will do as I say. Security." Ari didn't even flinch. She grabbed a scalpel from a nearby suture tray. "Dr. Cross, in the next 90 seconds, Lieutenant Commander Hayes will be dead. Your protocol will have killed him. You can have my license, you can have me arrested, but right now, I am the only person in this room who can save his life. So you have a choice. You can stand there and shout, or you can help me." She held his gaze. The entire trauma bay had fallen silent. Every doctor, every nurse, every tech was watching them, watching her. In that moment, she was no longer Nurse Carter. The quiet, unassuming facade had burned away, revealing the steel beneath. Her posture had changed. She stood taller, her shoulders squared. She was radiating an aura of command that silenced even the formidable Dr. Cross. Cross stared at her, his mouth agape. He saw the scalpel in her hand, the unwavering certainty in her eyes. He saw a level of authority he had never witnessed in anyone, let alone a nurse. He looked at the crashing monitor, at the dying soldier, and then back at the impossible woman in front of him. Desperation won. "What do you need?" he choked out. The tension in the room broke. I need that thoracotomy tray," Ari said, her voice now calm and precise, the field commander taking control of the battle. I also need 10 units of FFP and 10 of platelets to go with the PRBCs. We're bypassing the lab. This is a damage control resuscitation. Miller, I need you to bag him, 1 breath every 10 seconds. Sarah, she said to the other nurse, I want you pushing calcium gluconate after every 4 units of blood product. We need to fight the citrate toxicity. The orders came fast and clean. Each one was specific, logical, and far beyond the scope of a registered nurse. The team, accustomed to Cross's bellowing, responded instantly to her quiet authority. They moved with a new purpose. The thoracotomy tray arrived. Ari took the betadine swab and made a single, broad stroke across Hayes's left side, from his sternum to his spine. Scalpel, she said, holding out her hand. Cross, his face pale with shock, slapped the handle into her palm. She looked down at the patient. Then, for a split second, her eyes met the Admiral's again. His face was a mask of awe and dawning comprehension. Watch me, she whispered. It was a promise, a threat, a resurrection. Then she made the first cut. The blade sliced through skin and subcutaneous tissue in a long, sweeping arc along the 5th intercostal space. It was a bold, confident incision, not the hesitant work of a novice. Blood welled up, but she ignored it. Rib spreaders. The resident, Miller, fumbled with the heavy instrument before placing it in her hand. She inserted the blades between the ribs and cranked the handle. There was a sickening series of pops as cartilage gave way. The chest cavity gaped open, revealing the pulsing, dark lung and the frantically beating heart beneath it. The room gasped. This was brutal, primal medicine. An emergency thoracotomy, a last-ditch crack-the-chest maneuver, rarely performed outside of an operating room, and almost never with this speed and precision. He's still in V-Tach, a nurse called out. I see it, Ari said. Her hand, gloved and steady, disappeared into the man's chest. The team watched, mesmerized. She wasn't just a nurse. She wasn't even just a doctor. She was something else entirely, a warrior. Her fingers gently cupped the struggling heart. Internal paddles, charged to 20. Cross, now acting as her assistant without conscious thought, grabbed the small spoon-shaped paddles and handed them to her. She placed one behind the heart and one in front. Clear, she commanded. Hayes's back arched off the gurney as the electricity shot through his heart muscle. The jagged line on the monitor flattened, then resolved into a steady, rhythmic beat. Sinus tachycardia. Fast, but stable. A collective sigh of relief went through the room. He's converted, Miller whispered in awe. We're not done, Ari snapped, her focus absolute. The coagulopathy is the real enemy. Her left hand dove deeper, past the lung, toward the back of the chest cavity. Her fingers searched for the great vessel running along the spine. I'm going for the descending aorta. I need to clamp it to stop the blood flow to the lower body and redirect everything to the brain and heart. She was narrating the procedure as she went, not for her own benefit, but for theirs. She was teaching them. In the field, we call this REBOA, resuscitative endovascular balloon occlusion of the aorta, but we don't have the catheter or the time, so we do it manually. Her fingers found the thick rubbery tube of the aorta. Got it. Now, give me the longest Kelly clamp you have. Someone slapped the clamp into her waiting hand. She maneuvered it deep into the chest, the steel disappearing into the bloody cavity. There was a soft, metallic click. Aorta is cross-clamped, she announced. His pressure should start coming up. They all looked at the monitor. The numbers were climbing. 80/50, 90/60. It's working, Cross breathed, his voice filled with disbelief. Now we have maybe 15 minutes of clamp time before his lower body starts to die, Ari said calmly. That's our window to find and control the primary hemorrhage. Get me a laparotomy tray. We're going in. Another tray was produced. Without waiting, Ari took a fresh scalpel and made a long vertical incision from Hayes's sternum down to his navel. She cut through the abdominal wall, and dark, non-clotting blood immediately flooded the field. Suction, she ordered. A lot of it. 2 suction lines were placed into the abdominal cavity, gurgling as they pulled away liters of blood. The Admiral was right, Ari said, her hands moving with blinding speed, packing gauze around the liver. The entry wound is in the right upper quadrant. It has to be the liver or the portal triad. She systematically packed all 4 quadrants of the abdomen, a maneuver designed to tamponade any bleeding and identify the source. When she removed the packing from the right upper quadrant, it was immediately soaked in fresh, dark blood. "There it is," she said. "Massive liver lac, Pringle maneuver. Miller, grab the portal triad. That's the hepatic artery, portal vein, and bile duct, and squeeze it between your thumb and forefinger. Hard." The resident, his eyes wide, did as he was told. The torrential bleeding slowed to a manageable ooze. "Good," Ari said. "Now, I need to find the foreign body." Her fingers gently probed the shattered liver tissue. The organ felt like wet sand. After a moment, her fingers stopped. Found it. She carefully worked her fingers around the object. Forceps. She was handed a pair of long DeBakey forceps. She guided them into the wound, her eyes fixed on a point only she could see. With infinite care, she grasped the object and slowly withdrew it. It was a tiny, wicked-looking metal dart, no bigger than her pinky finger. A dark, almost black substance was caked onto its tip. She dropped it into a sterile kidney basin with a soft clink. "There's your culprit. Now the real work begins." For the next 10 minutes, she worked in a silent, focused fury. She debrided the dead liver tissue, used an argon beam coagulator that Cross had the foresight to call for, and placed deep, complex sutures to tie off the bleeding vessels. Her hands were a blur, a symphony of efficient, life-saving motion. She was an artist, and her medium was living flesh. Finally, she took a deep breath. "Okay. Miller, release the Pringle." The resident relaxed his grip. The surgical field remained dry. "Bleeding is controlled," Ari announced. "Let's take off the cross clamp." She reached back into the chest, unclipped the aortic clamp, and withdrew it. They all watched the monitor. The blood pressure dipped for a moment, then stabilized at 110/70. A miracle. "He's stable," Cross said, his voice thick with emotion. He looked at Ari, at her face spattered with another man's blood, at the impossible calm in her eyes. "My God, who are you?" Ari didn't answer. She was already starting to close. She placed chest tubes, irrigated the abdominal cavity, and began the long process of putting a man who had been opened from chin to navel back together again. When the last skin staple was in place, she stepped back from the table. The trauma bay looked like a butcher's shop. But on the gurney, Lieutenant Commander Evan Hayes was alive. His heart was beating steadily. His blood pressure was stable. She stripped off her bloody gloves and gown, dropping them into a biohazard bag. Underneath, her blue scrubs were soaked through. She was trembling slightly, the adrenaline finally starting to recede. The room was silent, save for the steady beep of the monitor. Everyone was staring at her. The nurses, the residents, the techs. They had just witnessed something impossible. Dr. Marcus Cross walked over to her. He looked humbled, broken, and reborn all at once. The arrogance was gone, replaced by a profound, shell-shocked respect. He started, then stopped. He swallowed hard. "I've been a trauma surgeon for 25 years. I've never seen anything like that. The thoracotomy, the aortic clamping, in the ER. You saved his life. I would have let him die on the way to the OR." He extended a hand. "I don't know who you are or what your story is, but you are the finest surgeon I have ever seen. And I am sorry." The apology was raw and deeply sincere. It was the sound of a man's entire professional worldview being shattered and rebuilt in the space of 30 minutes. Ari looked at his outstretched hand, and after a moment, shook it. "Thank you, doctor," she said. Her voice was quiet again. The commander was gone. Nurse Carter was trying to re-emerge, but the pieces no longer fit. She turned and found Admiral Pike standing right behind her. He hadn't moved from his spot. He had watched the entire gruesome, miraculous ballet without a word, his face an unreadable mask. Now the mask was cracking. "Eris," he said, his voice rough with emotion, "they told me you were dead. We all did." My thoughts began to race, a chaotic flood after the dam of concentration had broken. I remember the report I hacked a year after the mission. Dr. Aris Thorne, KIA, body not recoverable. A neat, tidy lie to cover up a catastrophic failure. Their failure. "A body not being recoverable isn't the same as being dead, Admiral," I said, my voice flat. I was too tired for anger, too tired for recriminations. "Sometimes it just means no one is looking for a survivor." "We held a service," he said, his voice cracking. "I gave the eulogy myself. I spoke of your bravery, your sacrifice." "I'm sure it was very moving," I replied, a bitter edge creeping into my tone. "Was that before or after you classified the mission as a complete loss and buried it under 3 layers of executive privilege?" His face flinched. The shot landed. "What would you have done, Ari? Tell me in the comments, where are you watching from? This isn't a rhetorical question. What choice did I have? The mission was compromised from the inside. We had a traitor on the command team. We didn't know who. Releasing the truth about what happened in that valley, about the target, it would have started a war. A real one. Listing you and the team as KIA was the only way to contain the fallout. We truly thought you were all gone." He was pleading, in his own way. The powerful Admiral was asking for absolution from a ghost in bloody scrubs. "The traitor," I said, my voice low. "Did you ever find him?" Pike's eyes darkened. "Yes, Vice Admiral Jennings. He was selling operational intelligence to a private military corporation. They wanted the asset we were after. They ambushed your team." "Jennings," I whispered. I remembered him. A cold, ambitious man who always seemed to be smiling. He had personally briefed me on the mission's medical parameters. He had known exactly where we would be and what we would face. "He's in a black site prison for the rest of his life," Pike continued. "It was a quiet affair, no trial. He just disappeared. We couldn't risk the exposure." "And the PMC? The ones who ambushed us?" I pressed. "A group called Argenis, run by a man named Elias Vance, ex-CIA. We cut their government contracts, sanctioned them into oblivion. As far as the world is concerned, they ceased to exist 5 years ago." Pike's gaze drifted to the stabilized Lieutenant Commander Hayes. "But I'm beginning to think they just went deeper underground." The pieces clicked into place, the flechette, the carjacking. "This wasn't random," I said. "It wasn't a question. They were after him. Or they were after you." "They were sending a message," Pike agreed, his voice grim. "Vance must have learned that I was reopening the file on your mission. The official story held for 12 years. But some new intelligence came to light, something about the asset." "The asset," I repeated, "the reason for the entire disaster. A Pakistani nuclear scientist who had developed a portable dirty bomb and was looking to sell it. Our mission was to extract him before he could. We failed. The scientist and his device vanished in the firefight." "We thought he died in the ambush along with his research," Pike said. "But this new intelligence suggests otherwise. It suggests he got away, and that Vance and Argentis got his data, if not the device itself." He paused, his eyes locking onto mine with a new, terrifying intensity. "And it suggests there was a second survivor from that valley." Me. I felt a chill that had nothing to do with my sweat-soaked scrubs. For 12 years I had believed I was a ghost, because the Navy thought I was dead. But what if someone else knew I was alive? What if they had been hunting me all this time? My anonymity wasn't just a choice, it had been my shield. And I had just shattered it in the most dramatic way possible. "Why now, Pike?" I demanded. "Why reopen the file now?" "Because 2 weeks ago, an undercover agent in Yemen photographed Elias Vance meeting with a man who matched the scientist's description. He's aged, but the facial recognition software gives us a 94% match. If Vance has him, and he's finally perfected the device, he didn't need to finish. A portable, weaponized, dirty bomb in the hands of a ruthless mercenary with a grudge against the United States government. It was a nightmare scenario." Suddenly, the doors to the ER waiting area burst open. 2 men and a woman in dark, severe suits swept in, badges clipped to their belts. FBI. They were followed by a man who made them look like local cops. He was tall, gaunt, with pale eyes that seemed to see everything and reveal nothing. He wore a perfectly tailored suit that couldn't conceal the subtle bulge of a shoulder holster. He moved with a predator's grace. He wasn't FBI. He was something else, something colder. His eyes swept the room, cataloging the bloody scene in the trauma bay, the stunned doctors, Admiral Pike. Then his gaze landed on me. There was no surprise, no shock, only a flicker of cold, triumphant recognition, like a hunter who had finally cornered his prey after a very, very long chase. My blood turned to ice. It was him, Elias Vance. He hadn't been sanctioned into oblivion. He had just changed uniforms. He was no longer a mercenary. He was inside the system. Pike saw my expression and turned. His face went rigid. "Vance," he spat, his hand instinctively moving to his side, where a weapon would normally be. "Admiral Pike," Vance said, his voice a smooth, cultured purr that didn't match his lethal appearance. "What a chaotic scene. I heard there was an unfortunate incident involving your aide. My office is just a few blocks away. The director sent me to offer any federal assistance required." "Your office?" Pike asked, his voice dangerously low. "Yes," Vance said with a thin smile. "I'm the new Deputy Director of National Intelligence. I oversee interagency threat response. It seems there's a credible threat right here in this hospital." His pale eyes shifted back to me. A very old threat. It was a setup, all of it. The attack on Hayes wasn't a message. It was bait. They knew Pike would bring him to the nearest top-tier trauma center. They were flushing me out, and I had walked right into the trap. The flechette was a signature, a calling card meant for me. They knew I would recognize it. They knew I couldn't stand by and watch a man die. My own morality had been weaponized against me. Dr. Cross, who had been listening to this exchange with growing confusion and alarm, stepped forward. "I'm sorry. Who are you people? This is a sterile environment. I need you to leave." Vance gave Cross a look of mild amusement, as if a fly were buzzing in his ear. "Doctor, your part in this drama is over. We're placing this hospital under lockdown. National security." He gestured to his agents. "Secure all exits, no one in or out, and take them into custody." He pointed, not at Pike, at me, and at Dr. Cross. "What?" Cross exclaimed. "On what grounds? I'm the chief of surgery here." "On the grounds of conspiring with a known fugitive and terrorist," Vance said smoothly. "Dr. Aris Thorne, wanted for treason, espionage, and the murder of her entire Special Operations Unit 12 years ago." The accusation was so monstrous, so completely the inverse of the truth, that it took my breath away. They hadn't just listed me as KIA. They had framed me. Jennings wasn't the traitor. Or he wasn't the only one. The entire narrative had been a lie, crafted to make me the scapegoat for their own treason. Pike stepped in front of me, shielding me with his body. "Vance, you bastard! You're the traitor. You set her up." "Brave words, Admiral," Vance sneered, "but you're a dinosaur. Your version of the world is gone. This is my world now, and in my world, loose ends get tied up." The FBI agents moved forward, hands on their sidearms. The hospital staff scattered, screaming. What would you have done in Dr. Richardson's position? The question, meant for the audience of a distant screen, echoed in the chaos of my own mind. Except, my name wasn't Richardson. It was Thorne, and I had to decide what that name meant. Run again, or fight. I looked past Pike's shoulder at Vance, the smug certainty on his face, the cold dismissal of the lives he had destroyed, mine, my team's. There was no more running. The ghost was done hiding. I grabbed Dr. Cross by the arm. "Cross, listen to me. Your patient Hayes is not safe. They'll kill him to silence him. You need to get him to your OR, lock the doors, and do not let anyone in who isn't on your team. Do you understand?" Cross, pale and terrified, but with a newfound steel in his eyes, nodded. "What about you?" "I'm the diversion," I said. Before Pike could react, I ducked under his arm and sprinted. Not for the exit. Vance's men were already there. I ran deeper into the hospital, into the labyrinth of corridors and wards I now knew so well. "Get her!" Vance roared. The agents pounded after me. I rounded a corner, skidding on the polished linoleum, and slammed through a set of double doors marked radiology. The hallway was dark, the rooms on either side filled with the hulking alien shapes of MRI machines and CT scanners. I ducked into a control room, the door clicking softly shut behind me. My heart was a wild drum against my ribs. I was a surgeon, not a soldier. I knew how to put people back together, not how to fight. But the woman who had survived the Hindu Kush knew a few things. She knew how to disappear. She knew how to improvise. I could hear them in the hall, their footsteps slow and cautious. They were splitting up, checking the rooms. From the control room window, I could see into the MRI suite. The massive white donut of the machine sat silently in the center of the room. A plan, desperate and insane, began to form in my mind. I peeked out the door. One of the agents was moving down the hall, his back to me. In his hand was a standard-issue Glock. On his belt were a radio, spare magazines, and handcuffs, all metal. I took a deep breath. This had to be fast. I slipped out of the control room and crept up behind him. With every ounce of strength I had, I shoved him. He stumbled forward, caught off guard, right through the open doorway of the MRI suite. The effect was instantaneous and violent. The massive magnetic field of the machine, thousands of times stronger than Earth's gravity, grabbed hold of every piece of metal on his body. He was yanked off his feet as if by an invisible giant. His gun, his radio, the steel eyelets on his boots, they all became anchors. He flew through the air and slammed into the opening of the machine with a sickening crunch. His body was pinned, contorted at an unnatural angle, the powerful magnet holding him fast. He screamed, a sound of pure agony and terror. The other agents shouted in alarm and rushed toward the sound. I didn't wait to see. I bolted in the opposite direction, back out into the main corridor. I needed a weapon. I needed a sanctuary. The OR Cross was my only ally. I ran, my scrub sticking to me, my mind racing. Vance had called me a traitor, a murderer. He had twisted my survival into a crime. He had hunted me for 12 years, and now he had me cornered. He wasn't just here to kill me, he was here to erase the truth. As I neared the surgical wing, I saw him. Vance. He was standing there, calmly, as if he'd been waiting for me. One of the FBI agents was with him, a woman with a drawn weapon. He hadn't fallen for the diversion. "Clever trick with the MRI," Vance said, his voice echoing in the empty hallway. "You always were resourceful, Dr. Thorne. That's what your file said. Unconventional problem solver. It's a shame all that talent will be wasted." There was nowhere to run. The hallway was a kill box. Then, from a corridor behind Vance, Admiral Pike appeared. He was holding a fire extinguisher. His face was grim. "Vance!" he yelled. Vance and the agent spun around. In that split second of distraction, I acted. I grabbed a heavy metal IV pole from the wall and swung it with all my might at the female agent's gun hand. The pole connected with a crack of bone. She cried out and the gun clattered to the floor. Pike charged, spraying a thick cloud of CO2 foam from the extinguisher, blinding Vance. I scooped up the fallen gun. The weight of it was unfamiliar but not entirely alien. In the field, everyone carried a sidearm. Vance stumbled back, wiping the foam from his eyes, his professional calm finally breaking into raw fury. He drew his own weapon, a sleek, customized pistol. "You're a dead man, Pike," he snarled. "And you," he fixed his eyes on me, "are going to tell me where the scientist is?" "What are you talking about?" I said, my voice shaking slightly as I aimed the Glock at his chest. "I haven't seen him since the ambush." "Liar," Vance spat. "The intelligence was clear. The scientist escaped. And there was a second survivor who aided him. It had to be you. You've been hiding him all these years, haven't you? Where is he, Thorne? Where is the device?" A cold dread washed over me. This was the real reason he'd hunted me. He didn't just want to silence a witness. He thought I was the key to finding the ultimate weapon. He thought I had the bomb. The standoff was absolute. Me, with a gun I barely knew how to use. Pike, an aging warrior with a fire extinguisher. And Vance, a professional killer with the full weight of a corrupted intelligence agency behind him. "You're wrong," Pike said, stepping beside me. "She's been hiding from you, not with him. You've been chasing a ghost, Vance. Your intelligence was bad." "My intelligence is never bad," Vance said, a fanatic gleam in his eye. "She has him, and I will get him." He raised his pistol, aiming not at me, but at Pike. A choice, a test. What would I do? Let my old commander die or give up a secret I didn't even have? My finger tightened on the trigger, but before I could fire, a new voice cut through the tension. "Drop it, Vance." Dr. Marcus Cross stood at the entrance to the surgical wing. He was holding a syringe filled with a clear liquid. He looked terrified but resolute. "Ha! And what are you going to do, Doctor?" Vance sneered, not even bothering to look at him. "Sting me to death?" "This," Cross said, his voice steady, "is 300 micrograms of etorphine, elephant tranquilizer. It's what we use for large animal research in the hospital's vivarium. At this concentration, it will drop you before you can even pull the trigger, and in 60 seconds, it will stop your heart. So, I suggest you lower your weapon." Vance hesitated. The gun in my hand was a maybe. The syringe in Cross's hand was a certainty. The standoff was now a bizarre triangle of surgeon, admiral, and doctor against the rogue agent. "You're all dead," Vance whispered, his eyes darting between us. "You can't win." "We already have," I said. Because as Vance was distracted, Pike had pulled his phone from his pocket. He wasn't just holding it. He had an open call, the speakerphone on. A new voice, crisp and powerful, filled the hallway. "Elias Vance, this is Secretary of Defense Michael O'Connell. Your activities for the last 12 years have been the subject of a joint JSOCONI investigation authorized by Admiral Pike. Every word you have said in this hospital has been recorded. Your agents are being taken into custody as we speak. It's over." Vance's face crumbled. The arrogance, the control, it all dissolved into disbelief and pure animal panic. He had been played. Pike hadn't been reopening a cold case. He had been setting a trap of his own. The attack on Hayes wasn't the bait to find me. I was the bait to catch Vance. My mind reeled. Pike had known. He had known Vance would come for me. He had used me. Vance let out a guttural roar of frustration and rage. He wasn't going to be taken alive. He swung his gun toward me for one last spiteful act. Two sounds exploded in the hallway almost simultaneously, the sharp crack of my Glock firing, and the dull thud of Cross's syringe dart hitting Vance in the neck. My bullet went wide, shattering a window down the hall. But it didn't matter. Vance froze, his eyes wide. He clawed at the dart in his neck, a look of surprise on his face. He took one step, then another, his pistol slipping from his nerveless fingers. Then his eyes rolled back in his head, and he collapsed to the floor like a puppet with its strings cut. Silence. The hallway was filled with the smell of gunpowder and ozone. I stood there, the gun heavy in my hand, my arm trembling. Pike slowly lowered the fire extinguisher. Cross let the empty syringe injector fall from his shaking fingers. It was over. I turned to Pike, a storm of betrayal and relief churning inside me. "You used me." "Yes," Pike admitted, his face etched with regret. "I did. When the intelligence about Vance and the scientists surfaced, I knew he'd been hunting for you. I knew the only way to get him to expose himself was to give him what he wanted, a confirmed sighting of Dr. Aris Thorne. I had my best people looking for you for months. We found you working here 3 weeks ago." "And Hayes?" I asked, my voice cold. "Was he part of your plan too?" "No," Pike said, his voice dropping. "God, no, that was Vance's move. He must have had surveillance on me. He forced my hand. He made the timeline immediate. I was going to approach you quietly, to warn you, to ask for your help. He turned my operation into this bloody mess." He looked at the unconscious form of Vance. "But it worked. We got him. We got the confession. We have everything we need to dismantle Argenis for good." I felt a wave of exhaustion so profound, it was a physical weight. I had been a ghost, a fugitive, a traitor, and bait. My entire existence for 12 years had been shaped by the echoes of a lie. I lowered the gun. "What now, Admiral?" "Now," Pike said, his voice gentle. "Now you get to come home, Dr. Thorne. We clear your name. Publicly. We tell the truth. The real truth." I looked at Dr. Cross, who was staring at me with an expression of pure, unadulterated awe. I looked toward the surgical wing, where a man I had pulled back from the brink of death was lying stable because of skills I had tried to bury. Home. What did that even mean anymore? My home had been the battlefield. My family had been the team Vance had murdered. My identity was a ghost. "I don't know who Dr. Thorne is anymore," I said, the words feeling hollow. "I do," Cross said, stepping forward. "She's the woman who just performed a resuscitative thoracotomy with a damn scalpel and a rib spreader in my ER. She's the surgeon who saved that man's life when I was ready to call it. Whoever you were, Dr. Thorne, this is who you are now, and we need you here." The days that followed were a blur of federal debriefings, official statements, and the slow, bewildering process of resurrection. The name Ari Carter was erased, and Dr. Aris Thorne was reborn, not as a casualty of war, but as a hero. The story that was released was heavily redacted, but clear in its absolution. Dr. Thorne had been the sole survivor of a covert operation, forced into hiding due to threats against her life from a rogue intelligence faction which had now been neutralized. It was a neat, tidy story. It wasn't the whole truth, but it was closer than the lie I had been living. Elias Vance, revived and now imprisoned, gave up the location of the scientist in exchange for a deal. The man had been living a quiet life in hiding, having abandoned his research after the trauma of the ambush. The threat was over. The file was finally, truly closed. I spent a week in a secure government facility telling my story. The story of the ambush, the firefight, the long, agonizing crawl out of that valley with a shattered leg and a body full of shrapnel. The years spent drifting, always looking over my shoulder, convinced that the same people who had killed my team would one day come for me. I had been right. I had just been wrong about who they were. When it was all over, Admiral Pike sat across from me in a sterile debriefing room. "So what's next for you, Aris?" he asked. "The Navy would reinstate you, of course. Full rank, back pay. You could write your own ticket, head up research at Walter Reed. Anything you want." I thought about it. The uniform, the structure, the return to the world that had both made me and broken me. I am no longer the person who can fit neatly into that world. The ghost of Ari Carter, the quiet nurse, is now part of me. The brutality of the ER, the civilian chaos, it had become a different kind of frontline, a different kind of home. "I don't think so, Admiral," I said. "My war's over." He nodded slowly, a sad smile on his face. "I thought you might say that. So what will you do?" "I think," I said, a genuine smile touching my lips for the first time in what felt like a lifetime, "I'm going to accept a job offer." 2 weeks later, I walked back into Kings Harbor General. I wasn't wearing scrubs, I was wearing a crisp lab coat. Embroidered over the pocket in neat blue letters were the words, "Dr. Aris Thorne, Director of Special Operations Surgical Training." Dr. Cross met me in the lobby. He was beaming. "We had to create the title," he said, shaking my hand warmly. "The hospital board was so impressed and frankly terrified by your debriefing that they agreed to anything. They want you to build a program from the ground up, to teach our surgeons what you know, to bridge the gap between military and civilian trauma medicine." "A bridge," I said, liking the sound of it. "I can do that." He led me toward the trauma bay. It was quiet for a change, clean and waiting. It no longer looked like a place to hide. It looked like a place of purpose. "Your patient, Lieutenant Commander Hayes, is asking for you," Cross said. "He's been moved to the ICU, fully conscious. He wants to thank the ghost who saved his life." The ghost. Maybe that's what I would always be in a way. A survivor who had walked out of the valley of death. But I was no longer hiding in the shadows. I was bringing the lessons of the shadows into the light. I looked at Cross, the man who had been my antagonist and was now my biggest advocate. I looked at the doors to the ER, the gateway to a life I had chosen, not one I had fallen into. My past was not a burden to be suppressed, it was a foundation to build upon. My skills, honed in the crucible of war, had a place here, not to destroy but to heal, to teach, to lead. This was my new mission, and for the first time in 12 years, I was ready for it. I was no longer running from the ghost of Dr. Thorne. I was her, whole, finally.